Hello guys, we are dealing with the vasculature of the posterior abdominal wall. Today we'll look at the inferior vena cava, right? Inferior vena cava or IVC, inferior vena cava, is the largest and widest vein of the body. It drains most of the blood from the body below the diaphragm, right, into the right atrium of the heart, right? So let's look at the formation, how it's formed and all. The IVC is formed by the union of the right and left common iliac veins in front of the body of L5 vertebra below the aortic bifurcation and behind the right common iliac artery. We'll go. Okay. And you see this is the inferior vena cava, right? This is the inferior vena cava. And this inferior vena cava is formed by the right and left common iliac veins, right? This is the right iliac vein, selected structure is, and the selected structure is left common iliac vein. These two common iliac veins become the inferior vena cava and ascend into the right atrium. It ascends in front of vertebral column on right side of the aorta. You'll see, you see, this is the vertebral column in front of the vertebral bodies, right? And this is slightly left to the, slightly, not slightly, but this is right of the aorta. You see, this is aorta and inferior vena cava is right of the aorta. You see, aorta, right? It is formed in front of the aortic bifurcation, right? That is aorta. It then arches forward on the right crest of the diaphragm, right, to reach the groove on the posterior surface of the liver between right and left caudate lobes. Just above the groove, it pierces the central tendon of the diaphragm, right? So it reaches the diaphragm through the posterior surface of the liver, right? We'll look at that. You see the blue selected structure is diaphragm, right? And it pierces the diaphragm. The inferior vena cava is piercing the central tendon of the diaphragm, right? See, that is called as caval opening, right? And this is the liver you are seeing, and it is related to the posterior. Okay, the selected structure is caudate lobe of the liver, right? This one is caudate lobe of the liver, right? So the inferior vena cava is, you see, related to the caudate lobe of the liver, right? Right and left caudate lobes of the liver. Okay, you see how it is related, right? So through that caudate lobe of the liver, it reaches the central tendon of the diaphragm. At the level of T8 vertebra and terminates by entering the right atrium of the heart. You see? Okay, this is the diaphragm, and here is the inferior vena cava, right? And here is the right atrium. Okay, this is the heart. You see? This is the heart. It is entering into the posterior-inferior part of the right atrium, right? Observe carefully. You see? That is there is inferior vena cava. The IVC extends across the 8 vertebrae, L4 to T8, right, and is about twice the length of the abdominal aorta. The normal diameter of the adult inferior vena cava is up to 30 mm, right? The abdominal portion of the inferior vena cava is devoid of walls. You have to remember these things. You see. So in the diagram, you can see this is the femoral vein, right? After crossing the inguinal ligament, it will be known as iliac veins, right? External iliac vein and internal iliac vein formed as common iliac vein, and these two common iliac veins formed as inferior vena cava, right? Okay, inferior vena cava. You see, this is the femoral vein. Femoral vein. This is the external iliac vein, right? And this one is the internal iliac vein, right? And you see this, this is common iliac vein. This external iliac vein becomes common iliac veins, right? These common iliac veins becoming inferior vena cava. This is inferior vena cava. This is common iliac vein. Common iliac vein. So this is inferior vena cava. This is common iliac veins. Right? You see, this is the inferior vena cava. Right? All of this is inferior vena cava. Coming to the relations, IVC is related anteriorly from below upward, right? From below upward, the structures anterior to IVC as it ascends are root of the mesentery, right? Right testicular or ovarian artery. We'll see that. You remember from the last class, right? Right testicular and ovarian arteries, right? You see, this is the ovarian or gonadal artery, right? Gonadal artery, either testicular or ovarian artery, is in front of the, you see, in front of the inferior. This is inferior vena cava, right? And this is testicular artery, only right side, right? Right testicular or gonadal artery, and third part of the duodenum, right? You see, the selected structure is duodenum, right? This duodenum is in front of the inferior vena cava. You see, inferior vena cava, third part, and gonadal artery, right? Head of the pancreas and bile duct. See, this is the head of the pancreas, right? So you can the whole pancreas you can visualize, and this is common bile duct, right? So these are in front of inferior vena cava. You see, this is the head of pancreas and this is common bile duct, right? And portal vein, see, this is the portal vein in front of the first part of duodenum. This one is portal vein, right? Posterior surface of the lever between right and left cardiac lobes. You have already seen that. So these are the anterior relations of the inferior vena cava. And coming to the posterior relations, from below upwards, the structures posterior to IVC are right sympathetic chain and psoas major. As the IVC is on the more of the right side. It is all related to the right things, right? So you see, this is the right sympathetic chain, right? Sympathetic chain, right? Whole of this, see the nerves here, all of these are sympathetic chains, sympathetic chain, right? This is the right sympathetic chain, okay? And this one is OS major, right side, right? Pillar. So right OS major, right sympathetic chain, and right renal artery, right? See, this is the right renal artery. This one is right. Delete these things, okay? This one is right renal artery. Okay, you have learned that in the previous class. And next one is the right celiac ganglion. Here is the celiac ganglion, right? That is celiac ganglion. And coming to the suprarenal gland, right suprarenal gland, right middle suprarenal vein, and right inferior phrenic artery. See, you see the suprarenal gland here, okay, above the kidney, okay, visualize the kidney, suprarenal gland, suprarenal vein, and inferior phrenic artery, right? Those are the posterior structures, posteriorly related structures of the IVC. You see, so this is IVC, right? Renal artery is posterior, sympathetic chain is posterior. See, this is the sympathetic chain, and psoas major is posterior, right? Suprarenal gland is posterior. You can clearly see that, right? So the anterior and posterior relations are thus visualized. Coming to the tributaries, right? Inferior vena cava. Tributaries are common iliac veins, lumbar veins, right testicular or ovarian vein, renal veins, right suprarenal vein, inferior phrenic veins, and hepatic veins. See, this is the inferior vena cava. These are right and left common iliac veins, right? Common iliac veins. And these are the lumbar veins. 1, 2, 3, 4, 5, right? And suprarenal veins, renal veins, right? Phrenic vein. These are the tributaries. 3 formative tributaries. That means these forms the inferior vena cava. 2 common iliac veins, and the median sacral vein. Median sacral veins you have already learned that, right? You see, these are the 2 common iliac veins, right? These are the 2 common iliac veins and median sacral vein. The latter may join the left common iliac vein. Each common iliac vein receives a iliolumbar vein. You see, this is iliolumbar vein, right? So these iliolumbar veins drains into the common iliac veins, right, which further drains into the inferior vena cava. The abdominal wall tributaries, inferior phrenic vein and 3rd and 4th lumbar veins. See that. And you see, these are the lumbar veins, right? These are the lumbar veins, both sides, right? Lumbar veins and inferior phrenic, okay, that is below the diaphragm, right? The first and second lumbar veins end in the ascending lumbar vein. See, only third and fourth lumbar veins drain into the inferior vena cava. Okay, only third and fourth. First and second drains into something, and fifth drains into something. Right? These two drains into the ascending lumbar vein, and this one to the iliolumbar vein. Right? The lateral visceral tributaries, right suprarenal vein, renal vein, and right testicular or ovarian vein. The left suprarenal vein and left gonadal veins drains into the left renal vein. So, left renal vein, suprarenal vein, and right suprarenal vein, renal vein, and gonadal vein drains into the inferior vena cava, whereas left gonadal vein and suprarenal vein drains into the left renal vein. Right? We'll see that. See, this is the right renal vein, and that is suprarenal. You see, the suprarenal vein is draining into the inferior vena cava, right? And also here is the gonadal vein, right? So these directly drains into the inferior vena cava, whereas the left side don't drain into the inferior vena cava, whereas they drain into the renal vein itself. The three anterior visceral tributaries are right, middle, and left hepatic veins. See, these are the hepatic veins, right? These are the hepatic veins. That is left hepatic vein, and this is intermediate hepatic vein, and this one is right hepatic vein. You can clearly see that, right? They are all draining into the inferior vena cava. This one is left, this one is intermediate, and this one is right. Right? You see? Let me. You see? This is the left renal vein, right? Left renal vein. And if you see the left suprarenal vein is draining into, right? You can observe that draining into the left renal vein, and also left ovarian vein. Here is left ovarian vein is draining into the left renal vein, left gonadal vein, right? So left gonadal vein and left suprarenal vein are draining into the left renal vein, right? Whereas here is the right renal vein, and here is the right suprarenal vein, right? And here is the right gonadal vein. So all these directly emptying into the inferior vena cava. You have to remember these things, right? You see, these are the renal veins, and these are the hepatic veins. You see, this is the left hepatic vein, and this is intermediate, right? And this is right. Okay. There are no tributaries from the abdominal part of the gastrointestinal tract. Okay. The spleen, pancreas, or the gallbladder, because veins from these structures are components of the portal venous system, which first passes through the liver and then empty to the inferior vena cava through hepatic veins, right? Coming to the lumbar veins are unique in their connections and deserve special attention. Not all lumbar veins drain directly into the inferior vena cava. The fifth lumbar vein generally drains into the iliolumbar vein, right? Third and fourth drains into the inferior vena cava, whereas the first and second, right? First and second drains into the ascending lumbar vein. Ascending lumbar veins are long, anastomosing venous channels that connect the common iliac, iliolumbar, and lumbar veins, right? With azygos and hemiazygos veins of the thorax. So these connect the thorax to the pelvis. Okay, from thorax to the iliac. Common iliac, iliolumbar, and lumbar veins are pertaining to lumbar, pelvic, and abdominal supply, whereas the azygos and hemiazygos veins are from thorax. So, if the inferior vena cava becomes blocked, the ascending lumbar veins become important collateral channels between lower and upper parts of the body. You see, this is the inferior vena cava, right? This is hemiazygos vein. Azygos and hemiazygos veins, right? So this long, slender one is ascending lumbar vein. So this connects azygos vein into the common iliac, iliolumbar, right? This is the iliolumbar. This is lumbar. So this ascending lumbar vein connects thoracic to the lower limb or abdominal pelvic veins. So if at all inferior vena cava is obstructed by some reason, this is the collateral circulation, forming collateral circulation, right? And you can see that. Okay, we'll end. So you see, this is the ascending lumbar vein, right? That is left side, and here it is right side, right? Ascending lumbar. This is long, slender, connecting to the common. You see, this is the common iliac, right? And lumbar, iliolumbar. So if at all the IVC is compressed, the IVC is commonly compressed by an enlarged uterus, right? During the third trimester of the pregnancy, right? This causes edema of the ankle, feet, and varicose veins in the lower limb. The compression and blockage of the IVC by malignant retroperitoneal tumors results in dilatation of the anastomotic channel between IVC and superior vena cava, caval shunt, so that the blood could be returned to the right atrium, right? So this is inferior vena cava. It can be blocked or compressed by enlarged uterus in the third trimester of the pregnancy or by any tumor, right? So this is carrying the whole all of the blood from the lower limb and abdomen and pelvis to the right atrium. Okay, below the diaphragm, all organs drain into the inferior vena cava, right? Let me know if you have any questions or doubts, right?